City.
647, the number of measles cases continues to grow. Now well over 500 reported across the country. That's more than the last 2 years combined. But as that number gets bigger, the number of kids getting vaccinated in our local schools is getting smaller. Doctors tell us that puts Florida at a higher risk for its own measles outbreak.
Patrick Walsh had his 7-year-old daughter, Maddie, vaccinated, but he said he battled with that decision.
The decision to vaccinate was a tough one because we saw both sides, but we were trying to be as well educated as possible.
And the number of parents deciding not to vaccinate their kids are going up. In Florida, it's required to be vaccinated to go to public schools unless parents submit a medical or religious exemption. CBS 12 reached out to our local school districts. In Martin County, the number of exemptions jumped by 200 students over the last year. The total is now 974 with exemptions. And that number mirrors a statewide trend. Data from the Department of Health shows religious exemptions in the state have almost doubled over the last 5 years, climbing now to almost 25,000 kids.
When you increase the numbers of people that are not vaccinated or are under-vaccinated, you are increasing the chance, even for fully vaccinated kids, to acquire illness.
While there has been only one reported case of measles in Florida this year, Dr. Sanborn says with the number of travelers coming to our state, that number could go up. Even the kids that are vaccinated have about 97% protection from measles.
These are vaccine-preventable illnesses, and if you make a personal decision to not vaccinate your child, it's not an isolated decision. You're affecting the health of your whole community.
And Richard believes that whether a parent vaccinates their children or not should be up to the parents, but maybe they should choose to homeschool their kids instead.
I think we all want our children to be healthy and live long lives and disease-free.
Now, as for what counts as a medical exemption for a vaccine, Dr. Sanborn says it's very uncommon. Only kids dealing with autoimmune diseases or those going through cancer treatment or those that are allergic to the vaccine should have medical exemption.